G'day, I'm Lorimer Moseley. I'm coming at you from Ghana country in Adelaide in South Australia. Gail has asked me to answer a few questions before our panel. Question one is, what is pain education and what are its key principles and goals in helping people with persistent pain? I guess pain education comes with two bits to it. The first bit, which is something we've been concentrating on for 25 years, is imparting the why of evidence-based treatments for pain. And what I mean by that is helping people to understand enough about how pain works inside them, inside their body, inside their brain, inside their nervous and immune systems. Understanding enough of that in order to be able to start negotiating your individual way towards recovery and towards improvement. The second part of pain education is how to do that. For a long time, we've had a growing understanding of what, on average, are the best ways to improve your life when you have persistent pain or to prevent persistent pain. But we haven't seemed to worry about giving people an understanding that makes sense, that gives them the why of that. I think for a long time, we've thought, do this. And I'm really interested in pain education that doesn't say that, just says, let us share as best we can what's now understood through scientific processes to be how pain works and how recovery could work. And you decide what you want to do with that. Second question. I've only got 5 minutes here, so I hope I don't go over. Explain the role of physiotherapy beyond addressing structural issues. Well, I think the role of most health professionals around persistent pain is an education role, is providing skills, principles, and processes by which you can guide your own journey towards recovery. Physiotherapists are highly trained in anatomy and physiology and movement progression and strength training and have skills in being able to do things that can relieve pain temporarily. But I think in persistent pain, their high level skills in uh, reassurance, in education, in imparting understanding, skills and processes are the key. And I think they have a very big role in that. Question three, key physiotherapy approaches or techniques that are effective for individuals with persistent pain and why? Well, my answer to that would be it all depends on the person in pain, the preferences of the person in pain, their understanding, their access to care, their resources, their time they can put into it, the money they can put into it, their cultural context, their education level. Uh, Really the main thing is their preferences, and I think the challenge really sits with the physiotherapist or the other healthcare professional to be attuned to that and to never take on it's up to me to fix you. Like as a physio in persistent pain, I don't think it is up to me to fix you. It's up to you to do that, and it's up to me to do my very best job in helping you develop the resources, the skills, the understanding that will allow you to do that. Question four, how can public health initiatives contribute to the prevention and better management of persistent pain at a population level? We don't yet know this, but this is what we're most excited about in our own research program. And I know people in the UK are doing similar work around the flip and pain and other initiatives. We are working really hard on this and investing a lot of time in key communities across Australia. We're investing in training health professionals and we are co-designing public health messaging. And what that means is that we're actually at the stage where we're going into specific communities and working with them to say, this is what we can bring. We have expertise in the science, the biology, and what to do about it. We need you with expertise in this town, in the issues facing this town, in your community, in the pathways, in the way people get together and communicate. And together we're going to design a campaign. So we're excited, but we don't have the data yet. So I don't know is the easy answer. In your opinion, what are the key priorities for public health efforts in addressing the challenge of persistent pain in the future? I think the key priorities is to just give it a bit more attention. The global burden of disease data clearly show that chronic pain conditions are the most disabling conditions we have. They elevate risk for other conditions from which people die, cardiovascular disease, diabetes, stroke, cancer, those sorts of things. It's ridiculous to me that there's not more concerted strategy going into how do we reduce pain-related disability, and the best way to do that, I think, is by thinking, well, what does help? And I think there's really good evidence about what management approaches are more effective than others, and there's really good evidence about what messages are more helpful than others around this. We need structural and system change, obviously, and public health policy will have to penetrate a whole lot of stuff if we're really going to turn this around. But I think we can. That's my 5 minutes. See you soon. I'm gonna look for the stop recording button like now, but here it goes. There it is. See ya.